Welcome to Safety Training, Healthcare for Adecco, the world's largest staffing services company. You have already completed our General Safety Orientation course. This follow-on module covers additional information relevant specifically to associates working in the healthcare industry. Employee safety is our highest priority. After completing this training, you should be able to list the 5 most common types of associate injuries and best practices for preventing them, describe the importance of personal protective equipment, or PPE, common to the healthcare industry, and describe the specific safety guidelines you should follow when working with equipment often used for healthcare.
Please note that for the remainder of this video, when we say Adecco, we are referring to the Adecco Group.
Let's start with a brief overview of some roles associates hold in the healthcare industry, along with some general safety protocols to follow at any worksite. Adecco associates fulfill many roles in the healthcare industry. This includes clinical staff working as nurses and therapists in hospitals, nursing homes, schools, and private homes. Let's explore some of the most common roles associates hold in the industry. Clinical healthcare associates provide and coordinate patient care, educate patients about various health conditions, and provide advice and emotional support to patients and their family members. Certified nursing assistants, or CNAs, aid nurses and coworkers, and assist with activities of daily living, also known as ADLs, such as feeding, bathing, dressing, and other essential tasks. Licensed practical nurses, or LPNs, provide basic nursing care and are responsible for the comfort of the patient. Registered nurses, or RNs, administer medication, treatments, and offer educational advice to patients. Healthcare has many unique workforce challenges, including higher risk of exposure to COVID-19 and other infectious diseases, workplace violence from patients, family members, and even staff, and musculoskeletal injury from lifting and moving patients. These interactions can lead to on-the-job injuries and illnesses, and are compounded by a persuasive patient-first mentality on the part of caregivers who put themselves at risk of injury for the sake of their patient. Additionally, associates should be aware of emergency procedures and know how to respond in case of accident or injury. Regular safety training and communication can help prevent accidents and ensure a safe work environment. In this section, we'll explore some common associate injuries, as well as some strategies to keep yourself safe while on the job. The 5 most common types of associate injuries in the healthcare sector include musculoskeletal disorders, MSDs, slips, trips, and falls, cuts and lacerations, workplace violence, and psychological stress. Musculoskeletal disorders, or MSDs, are injuries caused by wear and tear on the body's muscles, nerves, tendons, joints, cartilage, and spinal discs. Strategies for preventing MSDs include: use ergonomically designed tools and workstations. Ergonomics is the process of designing the workplace and job demands to match the physical capabilities of the worker. Maintain postures that reduce physical stress on your body, especially while lifting and carrying heavy loads. Get help from a dedicated lift team if possible when lifting and moving patients. Take stretch breaks before heavy work and after holding an awkward posture or spending extended periods on repetitive tasks. Slips, trips, and falls can occur when working on wet surfaces or in cluttered work areas. In the healthcare industry, floor surfaces are often contaminated with water, grease, or other fluids. Strategies for preventing slips, trips, and falls include: keep floors and walkways clean, dry, and free of clutter. Areas of special concern include the lobby, employee entrances, kitchens, and public bathrooms. Wear slip-resistant footwear. Keep work areas well lit and always heed wet floor warning signs. Cuts, punctures, and lacerations are often caused by handling sharp objects, including hypodermic needles and syringes, suture needles, winged steel, butterfly-type needles, blood collection needles, scalpels, and IV stylets. Strategies for preventing cuts and lacerations include: keep any sharp objects in view while in use. Pay close attention to the people around you to avoid accidental mishaps. Avoid passing sharp objects hand to hand. Use verbal alerts when moving sharp objects. Never recap used needles. Be alert for sharp objects that have been tangled in linens, dropped on the floor, or discarded in wastebaskets. Properly dispose of all sharp objects in rigid sharps containers. Workplace violence includes a variety of behaviors, from clear acts of violence such as hitting, kicking, or biting to threats, verbal abuse, and intimidation. It covers all behaviors that create safety concerns for associates and may arise from violence by patients, their family members, coworkers, and criminals looking for cash or drugs. Strategies for prevention include obtain training in conflict resolution, along with strategies for diffusing or de-escalating potentially violent situations. Be aware of site-installed physical safety devices including cameras, metal detectors, and weapons detection systems. Make use of security escorts to reduce the risk of assault in isolated areas like parking lots or other areas of the facility late at night. Limit patient and family access to staff restrooms and enclosed nurses' stations. If available, use card-controlled access and other restrictions that limit movement of violent persons and can provide you with a safe place to go if violence does erupt. If working with mental health patients, consider the use of panic buttons to signal an emergency or a portable emergency contact device to alert supervisors. Psychological stress can lead to poor mental and physical health, impacting an associate's psychological, emotional, and social well-being. Strategies for prevention include incorporate exercise into your daily routine. This can be as simple as taking a 10-minute walk during the day. Stay hydrated. Simply remembering and taking the time to drink water is an act of self-care. Make time for things you enjoy, from a movie night to crafts to spending time outdoors. It is beneficial to carve out some time each week for at least one thing that makes you happy. Stay well rested. Sleep may be hard to come by for many healthcare workers, but it is so important. Try your best to set a sleep schedule that works for you and stick to it. Practice self-compassion. If you start to feel overwhelmed, remember you are human. You are doing the best you can to take care of yourself and others. It's okay to make mistakes. Express gratitude. Many find that writing down or simply thinking of at least one thing you are thankful for each day can benefit their mental health. Stay connected to others. It can be easy to feel lonely or to isolate yourself when you're feeling overwhelmed. However, it is essential to make time to chat with a friend. Whether in person or over the phone, staying connected during difficult times is an excellent form of self-care. The use of personal protective equipment, PPE, in healthcare settings is an important element in promoting patient safety and increasing the safety of nurse associates. According to the Occupational Safety and Health Administration, OSHA, PPE in the healthcare setting is defined as specialized clothing or equipment worn by an employee for protection against infectious materials. PPE creates a physical barrier that prevents nurses from becoming exposed to blood and body secretions, bacteria and viruses that may be spread through direct contact with patients and their surroundings, and/or infectious airborne particles. PPE is critically important to preventing the transmission of infection in the healthcare setting. Gloves help to protect associates from exposure to the patient's body and body fluids. Wear gloves when directly handling potentially infectious materials or in contact with contaminated surfaces. Choose vinyl, latex, or nitrile gloves, depending on your allergic sensitivities and preference. Change gloves when they are visibly soiled, torn, or punctured. Wash hands after removing gloves. Gloves do not replace the need for excellent hand washing. You may need to wear a gown in certain instances to protect you from exposure to the patient's body and body fluids. Wear a gown when contamination of clothing with potentially infectious material is possible. Your gown should fully cover the torso, fit close to the body, and cover the arms to the wrists. Choose a gown appropriate to the situation, such as disposable versus reusable, requires laundering, fluid-resistant versus non-fluid-resistant, sterile versus clean. Goggles help protect your eyes from splatters, and face shields provide splatter protection to facial skin, eyes, nose, and mouth. Goggles should fit snugly over and around the eyes or prescriptive lenses. Note: prescriptive lenses do not provide adequate eye protection. Wear a face shield when facial skin protection is needed in addition to eye, nose, and mouth protection. A face shield may be worn with an N95 respirator in place of goggles to provide eye and face protection. A face shield should cover the forehead, extend below the chin, and wrap around the side of the face. Surgical masks help protect your nose and mouth from splattered body fluids. Respirators filter the air before you inhale it to help protect you from microorganisms including bacteria and many viruses. For maximum protection, PPE should be put on in a specific sequence. First, put on the gown. Be sure to fully cover your torso from neck to knees, arms to end of wrists, and wrap around the back. Then fasten at the back of neck and waist. Next, secure your mask or respirator. First, be sure to secure ties or elastic bands at middle of head and neck. Next, fit flexible band to nose bridge. Then fit the device snugly on face and below chin. Add your goggles or face shield. Place them over face and eyes and adjust to fit. Finally, put on your gloves. Extend them to cover any wrist area not covered by the gown. In this section, we'll review some common equipment used in the healthcare industry, as well as some strategies for using machines and devices safely. We'll also explore some safe lifting procedures when handling or moving patients. Healthcare facilities are filled with complex and expensive medical equipment, such as robotic surgical machines, magnetic resonance imaging, MRIs, CAT scanners, and X-ray and ultrasound machines. The equipment available will vary significantly depending upon the medical services being provided. There are many pieces of equipment that are used for patient handling. Never operate any of this equipment unless you are properly trained to do so. Floor lifts and stand assist aids are also used to move patients. Floor lifts are portable and may be moved throughout the healthcare facility for a variety of patient handling tasks. Stand assist aids are also portable and provide the caregiver assistance getting patients in and out of bed. One type of equipment used for moving patients are ceiling lifts. Ceiling lifts are attached to the ceiling and include a pulley with sling to hold and lift the patient using a motorized system. Slide sheets and friction-reducing aids are non-mechanical sliding systems that have low friction properties to aid caregivers while turning, repositioning, and moving patients. Air-assisted lateral transfer devices use compressors to inflate a mattress or cushion for repositioning or lateral transfers with patients. Motorized wheelchairs offer the wheelchair occupant the ability to traverse independently via electronic driving controls and a battery-operated chair. Finally, motorized beds provide the caregiver and patient the ability to easily adjust the beds for comfort and safety.
Safety and injury prevention are always the highest priority in the workplace.
Safe needle devices have sharp injury protection, SIP features with engineering controls that are built into the product and are designed to prevent sharp injuries. These can be highly effective in substantially reducing injuries and preventing exposures. Panic buttons and emergency alarms are devices available to healthcare workers to increase their feeling of safety. They can be strategically placed or hidden and activated to alert police to an emergency. Personal alarm buttons are often found in hospitals, nursing homes, and medical facilities to ensure patients can get immediate help if needed. The use of patient lifts are strongly suggested to aid in lifting, repositioning, and transferring patients. Consider these safety guidelines when using patient lifts. Make note of the client site's procedures for patient handling and mobility. Follow any available flowcharts to help assess the safest and most appropriate equipment and lift procedure. Seek out training in how to operate the lift. Like all equipment, you should not use it unless you are trained to do so. Match the sling to the specific lift and the weight of the patient. Make sure the sling is not frayed or stressed at the seams or otherwise damaged. Don't use the sling if it's damaged. Prior to transferring, make sure that the patient is not restless or agitated. Keep the base, legs, of the mobile patient lift in the maximum open position. Keep the patient's arms inside the sling straps. Keep all clips, latches, and hanger bars securely fastened during operation. Prior to transferring, lock the wheels on all wheelchairs, stretchers, beds, or chairs. Don't exceed the weight limits for the lift and sling. Create and follow a maintenance safety inspection checklist. Manual patient handling is hazardous for both healthcare workers and patients. The most common patient-related tasks that lead to injury are lifting, repositioning, and transferring. According to the American Nurses Association, the ANA, Comprehensive Safe Patient Handling and Mobility, or SPHM programs, drastically reduce the risk of injury for healthcare workers and patients while improving quality of care. The use of technology, especially lifting devices, is critical to the success of these programs. As a healthcare associate, you should be sure to consider the following myths and realities of patient handling to make informed decisions regarding your health and safety, as well as your patient's health and safety. Myth 1 is that proper body mechanics, including the use of gait belts, prevent patient handling injuries. However, in reality, decades of research shows that proper body mechanics are not an effective way to reduce injuries that occur when lifting patients. Do not manually lift. Myth 2 is that manual lifting is safer and more comfortable for patients. In reality, manual lifting can result in skin tears, falls, and injuries to patients. Myth 3 is that using SPHM technology feels impersonal. This isn't true. In reality, healthcare workers can effectively use SPHM technology while incorporating the professional values of respect, dignity, and caring. Myth 4 says that healthcare workers who are physically fit are less likely to be injured. However, good health and strength may put healthcare workers at increased risk because their peers are more likely to seek their assistance when manually lifting patients. Myth number 5 is the belief that it's much faster to move a patient manually than to take the time to retrieve SPHM technology. However, SPHM technology is conveniently located. Accessing it will not take a long time. It is often more time-consuming to assemble a team of colleagues to manually lift a patient. The final myth is that smaller, lighter patients do not warrant use of SPHM technology. Again, this isn't true. The ANA recommends policies and practices that lead to the elimination of all manual lifting. The National Institute for Occupational Safety and Health, NIOSH, recommends lifting no more than 35 pounds under the best ergonomic conditions.
Now let's do a short 5-question knowledge check. Which of these injury types are common to the healthcare industry? Select all that apply. Asbestosis, needle sticks, musculoskeletal disorders or MSDs, slips, trips, and falls. Needle sticks, musculoskeletal disorders or MSDs, and slips, trips, and falls are all injury types that are common to the healthcare industry. True or false? You should never use any tools, machinery, or equipment unless you've been trained and authorized to do so by Adecco and your client supervisor. The correct answer is true. You should always ensure that you have been trained on the equipment that you're using by Adecco and your client supervisor. Which of these are equipment common to the healthcare industry? Select all that apply. The correct answers are patient lifts, safe needle devices, and panic buttons and alarms. True or false? Proper body mechanics, including the use of gait belts, completely prevents patient handling injuries. The correct answer is false. Which acronym is typically used to describe an injury caused by wear and tear on the body's muscles, nerves, tendons, joints, cartilage, and spinal discs? Select the best choice from the options given. MSD, OSHA, PIT, PPE. The correct answer is MSD, or musculoskeletal disorders. Thank you for completing this safety orientation. There are many additional safety concerns that are out of the scope of this orientation. You will receive additional training at the client site that is specific to the site and the job that you'll be completing. Your job safety is ultimately up to you. If you have a question about the safety of your job assignment or equipment, reach out to your Adecco representative or client supervisor.